Adult Health 1 with the sink. Today I'll be performing a Piggy line. Now I'm in the nursing station. I will be checking my doctor's orders. I see that my doctor has ordered Zosyn, and I am going to be administering it, and I've done my calculations, and I will be using timeout. Hello, my name is Samuel Humphrey, and I am in Adult Health 1. I'm in the sinks class, and I will be administering a Piggy mini bag. Now I'm in the nursing station, and I'm going over my MAR, and I'm looking at my doctor's orders. My doctor has ordered Zosyn, and I'm administering Zosyn into a 100 ml bag of saline. And I've done my calculations, and my drop factor is 4 drops per minute, and I will be administering an amount of 0.3 mLs of the drug. So I'm going to check the drug of Zosyn, make sure I'm matching it up with my MAR, and making sure that's the correct drug. And I'm going to check my expiration date. I'm also going to look over the MAR, make sure I check for the patient's history, any kind of allergies, anything of that nature. I'm going to then see to clean off the tip of the Zosyn container. I'm going to take my blunt needle and pull back 0.3 mLs of air. Insert. And check 0.3 mLs. Pull back 0.3. Yeah. So I'm going to inspect my 100 ml bag of saline. Make sure it's normal saline. I'm going to inspect for the expiration date. And I am then going to get my Piggy tubing. Take out the cap. And, excuse me, keep the cap on. Inspect the tubing. I'm going to take my port, clean the tip off with alcohol. Take my medication. Uncap. With my blunt needle. I'm going to insert. Inject my bag. Take it out. Dispose of my needle. Shop container. Mix my medication. Now I'm going to label my my medicine. I'm going to put on there my initials, date, time, the patient's name, room number, the drug and the amount, and the flow rate. And I will also put on the start time. I will then get my Piggy tubing. Take out the top. And spike my bag. I will prime my tubing. This is just paper, so I put the label down, but in a normal situation it would stick. I will prime my tubing. Tubing is primed. I will clamp it off. Place my medication, my tubing, everything on my MAR. I will go into my patient's room. I'll introduce myself. Hello, Mr. Johnson. My name is Samuel. And I will go into the patient's room. I'll ask Mr. Johnson to identify himself. I will match that with who identifies the patient's name and date of birth on the patient's armband. He's verified that, both name and date of birth. I will then perform hand hygiene. I will go in and proceed to put on my gloves. While doing so, I'll explain to Mr. Johnson that the doctor has ordered Zosyn, the Piggy bag, to be going in over the next hour. I will then assess the patient's IV site, and I will assess for bruising, swelling, edema, coldness, heat, any discomfort. The patient has state of none. I would check the IV line and hang the primary lower than the secondary. And that's it. I would then, assuming the INT is still patent, I would then clamp off the primary, hang my secondary, and attach my secondary below the primary's clamp. I would clean off the port and attach, and I would establish the flow rate of 4 drops per minute as already calculated. Fine. And establish the drop rate. I've done so. I would, the label will still be on there as stated before. This is just a piece of paper. Labels on here, and I will also label my tubing, initial date and time. And I would again assess the site. No any kind of irritability, bruising, swelling, any discomfort. I would take the patient's position. You have to use the restroom, any pain. Give the patient a call light and let the patient know that I will be back within the next hour or so to check on the patient. I would then take off my gloves. I would chart on the MAR, the time the medication was started, the amount, how the patient handled the procedure, the amount of IV fluid, and the condition of the IV site. I would then come back within an hour, gloves off, come back, knock on the door, and I would hand hygiene, place these gloves back on, assess the site, no bruising, swelling, activation, any discomfort. He has state of none. I would clamp off my piggyback, stop the meds. I would discontinue the medication. If needed for the alligator clamp, I would put an alligator clamp on there. And I would unclamp my primary. And again, assess the site and bruising, swelling, discomfort. And this patient has state of none. Assess for the 4 Ps, pain, any pain, level 1 to 10. I would, using the restroom, unit comfort position. And the possessions, I would give the call light again. And I would document the amount of fluid, condition at the site, how the patient handled the procedure. And